Let's talk about perimenopause, baby. Let's talk about you and me. Let's talk about all the good things and the bad things that maybe. Let's talk about perimenopause. Ladies, today I want to talk more about perimenopause. I've got many videos on this channel to do with my hormonal perimenopausal journey. For me personally, perimenopause and low thyroid has sort of coincided, but my thyroid now is under control. My medication is working. My thyroid is on the low side of optimal, but I am kind of like a low functioning person. A lot of my blood tests, things are low, but my thyroid is in range and happy with that. So now I know that what I'm experiencing is definitely due to hormonal decline, perimenopause, and I'm 44 turning 45, so I'm in the age range. So if you are new here, my name is Louise. I'm a South African. I'm a mother, an artist, a fitness enthusiast, but lately, I must say, this year, I'm really battling with my fitness and my commitment to going to gym because I'm starting to suffer more and more with one of the main perimenopausal symptoms, which is joint aches and pains. Over 40, I started to notice a pain in my hip, and every time I go for a run now, my hip sort of seizes up the day after. Now I'm also getting knee pain on the same side. And so in general, I'm getting that old age joint aches, joint pains. I don't know if you also notice it, but as I get up or sit down, I'm like, oh, oh. And I said to the doctor, I don't want to be going, oh, when I sit down or get up. But it is one of the very common signs or symptoms of perimenopause. So I don't know if that's something you're aware of, but I do want to just have an informal chat. So I invite you to make yourself comfortable, have a cup of tea, coffee, something nice to drink and relax. And let's just talk about perimenopause and commiserate and go through some of the signs and symptoms. I will share what I'm going through. And I would really appreciate and invite you to leave in the comments below anything that you are going through. If you are 40 and older, you may have noticed some of these and not realized it's perimenopause, or maybe you have realized. I mean, what I've learned is that a lot of YouTube viewers are quite educated. They learn a lot. There's a lot of information out there. And I'm not a doctor, but I'm somebody who does a lot of research and really, I notice things in my own body. I really try and learn, listen to myself, and become aware of things. So if you followed my journey at all, you will have known that I have tried both the birth control pill and bioidentical hormones for my perimenopausal symptoms. And very recently, I went back onto the pill to try and alleviate symptoms. I was off everything for about a year. The only thing I take all the time is my testosterone gel cream because I have tested my testosterone in the past and it is always low. And so this is one thing that I'm probably going to need to be on for the rest of my life. And that's okay. I'm happy with that. But I wasn't doing anything for my estrogen and progesterone. And over the year, I noticed that slowly I started to get worse and worse in terms of just not feeling optimal. And then the occasional night sweat, which then became very recently rapidly like regular night sweats. And then it got to the point, and we're in winter and it's cold, and it got very frequent night sweats where almost every night I was waking up drenched in sweat. And then you get that icy cold feeling because now it's winter and you get out to change and then you get back in, but the sheets and the duvet are sort of wet and cold. Anyway, so recent night sweats, also hot flashes in the day, which were something new for me. Brain fog I've experienced, that fatigue, that afternoon fatigue where you just cannot do anything. I would say for me, those are the symptoms. Maybe now I'm getting a bit of dry skin, but again, it is winter and that's pretty normal for winter. But my skin in other areas, not too dry. I haven't noticed any hair changes, but for me, brain fog, debilitating fatigue, joint aches and pains. Takes me longer to recover from exercise, but I also assume that with age, that's just going to happen with age. And what else is there? Yeah, the night sweats and the hot flashes. Oh, and I almost forgot the nausea. So very recently, along with the night sweats, and on the nights that I sweated, I noticed a correlation. Now, I know correlation is not causation, but in perimenopause, I think I can safely say, on the nights I night sweated, I would also be very nauseous in the mornings. And I definitely noticed a link between the two, Googled it, and it is a possible symptom. And I do think it's to do with that, because any hormonal change could cause that. So that was another one for me. And then I put myself on the pill. The morning nausea went away, but what didn't go away were the night sweats. So 3 weeks into taking a low-dose birth control pill, Femidine, I was still waking up sweating at night. So I thought, no, come on now. If the pill's not working, which it had in the past, then I've got to go back to the doctor. So I went back to the doctor and spoke to him again and said, can we just try the bioidentical estradiol one more time with the progesterone? And he was reluctant, because a year previous I had done that, and my estrogen levels did go a little bit high, not unnaturally high, not supra physiologically high, but he said, oh, they're a bit high. And I know my progesterone also went high, but I was also using the cream. And so I'd stopped everything, but what I should have gone to him and said was that, can we try half a dose? Anyway, this time we're starting up again. I started off on a full pump of estrogen, and then I did blood tests, and my estrogen level went back up to where it was before on the full pump. So I'm now on half a pump a day, half a pump of testosterone, and my progesterone capsule. It's only 50 milligrams, and I take that at night. And I was still having night sweats for about a week, and then 9 days in to the estrogen gel and all that, the night sweats thankfully stopped. So no more night sweats. Woohoo! Hooray! So that's awesome. So I can confidently say now that bioidentical hormones, I'm using a brand here in South Africa called Idexis. I'll put it on the screen. It is working. However, I did go and get blood tests. So like I said, my estrogen went a bit high, and I wanted to see whether using bioidentical creams, how would the absorption be, and how would the levels in your bloodstream be throughout the day. So I tested in the morning, and on the same day I tested in the afternoon, late afternoon, 3:30. I wanted to see whether the blood levels were quite consistent, or did they rise and then fall, or what was going on. So I was on a full pump back then of testosterone, and a full pump every day of the estradiol. Tested in the morning. Estradiol was high, 500 and something. I'll put it on the screen. Testosterone was only 1, and I was like, what? And then the afternoon tests, the results came back, and the testosterone by the afternoon was sitting at 4. Now, for women, the maximum on the test form is 1.9. So my doctor says around 2 is fine. 4. 4 is double what it should be. So I freaked out. So what I'm thinking is that the testosterone, I don't know if it's different molecule sizes. Oh, and the estradiol in the afternoon just dropped a little bit to like 400 and something. So the estradiol seems to go in. It's a little higher in the morning, but then it seems to be okay by the afternoon. So, but I freaked out. Testosterone of 4. I don't want to turn into a man. I don't want my voice to deepen. It's already getting deeper as I get older. So, and also what I have noticed is that my chin, the pores are looking a lot bigger and greasier. So I thought that's possibly because of the high testosterone. And now I'm thinking to myself, every test of testosterone I've ever done has always been in the morning. And maybe every single time it's actually rising in the afternoon. So of course I will go and do that again, where I will test morning and afternoon. So I've now reduced the dosage to half a pump of testosterone, half a pump of estradiol in the mornings. And then I will go and test those again, give it 2 weeks, test it again. So that was a week ago that I did the morning and afternoon blood tests. And I am so glad now that I spent the money and did it, because you really have no idea what's going on in your body until you do blood tests. And you might guess at things. You might say, oh, well, look, I'm getting a few pimples, but that'll go away. You don't know that your levels in the afternoon are so high. Every testosterone test I've ever done, the highest it's ever been, but this was in the morning, was 2.6. So who knows on that day whether by the afternoon it had risen to like 5. My God. So, of course, I'm not going to turn into man over a month or even 3 months of having a slightly elevated testosterone, but do that for years, year in, year out, and who knows what kind of side effects I could get. I could very well get chin hairs. I could very well get hair loss. I don't know. And I don't notice any difference in how I feel on half a pump or a full pump in terms of libido, energy, mood. I honestly cannot say that my mood was any better or I had any more energy on a full pump of testosterone. So I will say that going too high is, I don't notice it being any better for me. And I think the risk of side effects would be not welcome. So if you are on any form of HRT, bioidentical or synthetic or otherwise, whatever it is, please, 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 I say this over and over again, but please take the time to get some blood tests. Please just check your levels. Just check what's going on. I want to share another story with you about blood tests and the levels and how we think things are cool in our body and we actually don't know. I'm going to share the story of my boyfriend who is on testosterone replacement therapy under the guidance of his doctor. So he gets his PSA levels checked regularly because there is a link to prostate cancer and high testosterone. And so he's been going to his doctor for the injections. Now he's been on Sustanon and then he's switched over to Nebido. So there's 2 different testosterone injections. Sustanon, I think, lasts, if I'm correct, 3 weeks in the body, or 4 weeks, I'm not sure. And then the Nebido lasts like 3 months. So very recently he let his levels crash because, like all these things, it is a bit of a pain in the ass, excuse the pun, to go and get injected or whatever. So he'd let his levels crash. Then he went back to his doctor, had a Sustanon injection. 2 weeks later, though, he was still not feeling optimal, and he also gets night sweats when his levels of testosterone crash. So he knows what I'm going through with perimenopause. And he went back to the doctor, and we were thinking, well, maybe that particular Sustanon bottle was expired, or who knows why it didn't work, but he wasn't feeling optimal, and he was still sweating. So he went to get a Nebido shot, which is the testosterone that lasts for a long time. Anyway, like literally within a day or 2, the night sweat stopped and he was happy and he said he felt good. I said to him, but just get your levels checked. Just see where you're at. See how high the Nebido puts your testosterone at, because you're feeling good, you're not sweating. And I'd asked him to check his levels on the Sustanon, which he didn't, because I wanted to know why was he still feeling low. He didn't check. Anyway, after me moaning at him for a while and saying, go and get your blood test, go and get your blood test. And the doctor also wanted him to do tests. He did go. And oh my God, are we glad he went. His testosterone levels were through the roof. It was like 900 and something. I don't know what the unit of measurement is, but here in South Africa, I'll check it and put it on the screen. You can translate that to American units or wherever else in the world you are, in Australia maybe. But 900 is too high. He needs to be at around 300, 400. And he said, geez, no wonder he's feeling so good. But also, he is feeling a little bit, not hyper, but like go, go, go. And look, on the bright side, he's getting a lot of shit done. He's just attacking chores around the house. And that's wonderful. But it is dangerous to have super high testosterone levels, especially for a long time. It thickens your blood, your red blood cell count goes up. It can give you high blood pressure, blah, blah, blah. And his PSA levels are elevated. So the point of the story is that he was feeling good, but if he hadn't checked, he wouldn't have known that his levels were way too high. And he might have just cruised along, got another Nebido shot. So now what we want to know is whether the Sustanon and the Nebido crossed over and put his levels too high. So now he realizes, have to do blood tests. If you are putting something in, it's not being made by your own body, you have to check to see if it's working, to see what it's doing, to see what's happening. So for anything, thyroid medication, hormone replacement therapy, anything like that, please check your blood levels. So back to the ladies. So you can see men also go through a lowering of hormones, but they never run out of testosterone. So even in their 80s, they're still making some testosterone. It's nowhere near as high as when they were younger. But for us, we actually run out of estrogen. Our bodies no longer produce estradiol. So when we hit proper menopause, estrogen gone. Well, that one particular form, estradiol. We still make estrone from our fat cells. And I think the estriol is the one that we make a little bit of, but it's not really the one that does everything for us like the estradiol does. So there are 3 forms of estrogen. So you can see I've done my homework. But we need to replace, I believe, at least, we need to replace what we are starting to lack. And yes, I'm 44 and I might be a bit young, but I am replacing my estradiol and I'm feeling a lot better. I'm not feeling optimal yet. I've still got the joint aches and pains. I've still got that sort of low mood, that slightly depressive feeling that I tend to get. I think it's perimenopause. Look, it could also just be life. You know, when you hit 44, you just get the shits with life and people and being alive on the planet for so long. But there is kind of like a low mood. I don't feel anxious, but I feel like just grumpy, bitchy. Yeah, so I'm hoping that that will lift. It is lifting somewhat, but I'm not optimal yet. But no more night sweats. So I do think that it's worth investigating treatment options, help, whatever suits you and fits in with your philosophies, your body, your health concerns. But please, if you are feeling perimenopausal, don't just accept it if it's making your life miserable. Number one, educate yourself. Please educate yourself on all the signs and symptoms, and there are so many. Speak to a doctor. If he's not willing to help you or she, find another one, try another one, book a consult with somebody else. I know it's time and effort and energy, but an idea that I really love, and I heard this on a YouTube video, is that you can actually send out inquiry emails or make inquiry phone calls to endocrinologists or gynecologists or doctors that you are in your area and just ask what is their philosophy about HRT if that's something you're interested in. Ask how they treat women in perimenopause. Do they even prescribe for perimenopausal women? Because a lot of doctors will say to you, you're too young, you're in your 40s, you don't need it, you're not in menopause yet. They don't know the hell that it can be. And I'm not saying every woman goes through hell. Some women just sail through it or have very, very few or mild symptoms. Some women, like me, are really feeling it. And it's really, you don't have to. There is help available. I'm on the path to help. If you enjoyed this topic, you found it useful, please give me a thumbs up. As you can see, my channel is growing. I'm over 800 subscribers. I'm so happy, so thankful. Thank you, thank you, thank you. Thank you to all my new subscribers. If you are new here, please consider subscribing. Hit the notification bell if you would be so kind as to do so. I really put in a lot of time, effort, and energy into these videos. My heart wants to just share stuff that's useful. I hate clickbaity things. I hate things that are not actually useful to people. I don't like people that are just trying to sell and promote things on YouTube. I'm genuine and I want to just share stuff that really, really, really is beneficial, things that I'm going through. This is what I would tell my girlfriend. So I'm your friend on YouTube and thank you for being here. Thank you for watching. I will see you in my next video.